Mammography is a screening tool that uses X-rays to create detailed images of the breast. These images are called mammograms. Most mammography centers use digital breast tomosynthesis, which is also called 3D mammography. Imaging machines take multiple flat 2D images, then computer software combines these 2D images into a 3D image of the breast. Mammography is used in two ways. First, a screening mammogram can find early signs of breast cancer, like a mass in people who don't have any warning signs or symptoms. Mammography can also be used as a follow-up test when a person notices a change in their breast, or when something unusual is found on a screening mammogram or a clinical breast exam. This type of test is called a diagnostic mammogram. Mammography is the most effective screening tool available today to find breast cancer in most women. It can find cancer at an early stage, when it's too small to feel and when the chances of survival are highest. The benefits of screening mammography vary by age. Women ages 50 to 69 tend to get the most overall benefits. For women ages 40 to 49, mammography may save lives, but there are more benefits for older women. Some women may worry about radiation exposure from mammograms, but studies show the benefits of mammography outweigh these risks. Despite the ongoing debate about its benefits and risks, mammography is the most effective test used today for breast cancer screening. While any health decision is a personal one that involves weighing the benefits and risks, most reputable health organizations recommend that women get screening mammograms. Before a mammogram, you'll be asked to undress from the waist up and put on a gown or robe that opens in the front. You can store your personal items in a locker, and a technologist will guide you to the mammography machine. On the day of your exam, it's important not to wear deodorant or apply perfume, powder, or lotion to your breasts and underarm areas, as ingredients in these products can show up on a mammogram and make it harder to read. During a screening or diagnostic mammogram, each breast is imaged separately. The technologist will help position your breast on the machine, and it will be gently pressed between two plates while images are taken. You may be asked to hold your breath for a few seconds. For a screening mammogram, each breast is imaged twice, once from above and once from the side. With a diagnostic mammogram, the technologist will take more images to get a more detailed look. While the pressure on the breast during a mammogram may be uncomfortable, it only lasts a few seconds. Be sure to let the technologist know if you experience discomfort or have any concerns. The test takes a total of about 15 minutes, and most of that time is spent positioning your breasts in the machine. After you've had your mammogram, a radiologist will review the images. If you've had a mammogram in the past, the radiologist will compare the new images to the older ones to see if there are any changes. The radiologist will then write their findings in a report that will be reviewed by your healthcare provider and sent directly to you. You might receive your results right away, or they could take up to 2 weeks. Make sure you get your results. If you don't receive them within 2 weeks, contact your healthcare provider or the place where your mammogram was done. A screening mammogram may show no signs of breast cancer, or it can show certain findings, such as a benign breast condition, like a cyst or a fibroadenoma, both of which are common. Screening mammograms may also find an abnormal area, like a mass or some calcifications. If that happens, you'll be called back for more tests. These follow-up tests may include a diagnostic mammogram or a breast ultrasound. While a diagnostic mammogram can't diagnose breast cancer, it can show whether an abnormal finding looks suspicious. A breast ultrasound can be helpful in showing whether a lump is a liquid-filled cyst or a solid mass. Sometimes additional tests may be recommended, like a breast MRI or a biopsy. It's completely normal to worry if you're called back for more tests. This happens pretty often, and in most cases, abnormal findings are not breast cancer. If breast cancer is found, you'll be connected to a doctor who can help you understand your diagnosis and talk with you about what treatment options are best for you. Your mammogram report will also include a statement about your breast density. Breast density compares the amount of tissue to the amount of fat in your breasts. Tissue is denser than fat, and this difference shows up on a mammogram. Dense breast tissue appears light gray or white on a mammogram. This makes abnormal findings harder to see on a mammogram because they are often the same color as cancer. Younger women tend to have denser breast tissue than older women, which makes their mammograms harder to read. After menopause, breast density may decrease, making mammograms easier to read. Women with dense breasts have a slightly higher risk of breast cancer than those whose breasts have more fatty tissue. There are no special screening guidelines for women with dense breasts. If you have dense breasts, it's a good idea to talk with your healthcare provider about the risks and benefits of adding other types of breast imaging to your mammograms. Trusted health organizations provide recommendations for screening mammography. If you're a woman of average risk, the National Comprehensive Cancer Network, or NCCN, recommends having a mammogram every year starting at age 40. If you're a woman at higher risk of breast cancer, talk with your healthcare provider about which screening tests are right for you. You might be considered at higher risk if you have one factor that greatly increases your risk, or several factors that together add up to a higher risk. Men have a higher risk of breast cancer if they have a BRCA1 or BRCA2 inherited gene mutation. The NCCN recommends men with these mutations get regular breast cancer screening. Mammography is recommended every year starting at age 50, or starting 10 years before the earliest known male breast cancer in the family. Men with a PALB2 inherited gene mutation may also want to follow this recommendation. If you're a transgender person, the American College of Radiology offers breast cancer screening guidelines that are tailored based on several factors. Talk with your healthcare provider about a screening plan that's right for you. Susan G. Komen believes all people should have access to regular screening, when, together with their healthcare provider, they decide it's best based on their personal risk of breast cancer. For more information, visit the Screening and Early Detection section on Komen.org. You can also contact Komen's Patient Care Center. Our navigators offer free, personalized navigation services to patients, caregivers, and family members. They can provide you with breast health and breast cancer information, connect you to services and resources, offer emotional support, and more. Get connected with a Komen Navigator at 1-877-GO-KOMEN, Monday through Thursday from 9 a.m. to 7 p.m. Eastern Time, and Friday from 9 a.m. to 6 p.m. Eastern Time, or by email at helpline@komen.org.